Good afternoon and welcome to this month's SpectraCell Laboratories Discovery Hour. We are excited about the opportunity to share with you some vital information when it comes to men's health and MTHFR gene mutations. And we have an exciting speaker that has a long established track record with SpectraCell that has been utilizing our test, and we really couldn't think of anybody better for her than her to go over these particular topics. Before I introduce Dr. Bartlett, let me just tell you a little bit about SpectraCell for those of y'all that are new to the laboratory. So we were established back in 1993, so we've been doing business well over 30 years. We have a long proven track record as what I like to refer to as a boutique laboratory, because we offer such highly sophisticated and unique tests than what you might find anywhere else. We're based out of Houston, Texas, which is home to the world-renowned Texas Medical Center, and so it doesn't surprise me that we have access to very unique technology and also to a plethora of healthcare professionals and experts and such in the industry that we're in. We are a CLIA certified lab, and we've done over the last 30 years roughly 1.2 million tests, which gives us an enormous population database to be able to make the comparisons that we do in deriving the results that we have from our various tests that we offer. We have a global reach. We are not only in the United States, but we are throughout Canada and the Caribbean and Central and South America, and our furthest accounts are in the Middle East and Israel and Dubai. So the one thing that kind of limits us is the logistics. And what I mean by that is our micronutrient test, which is our flagship test. We deal with live blood cells. In addition to that, we have a lipoprotein particle profile, and we have our MTHFR test that we will be talking about today with Dr. Bartlett. And then we also offer a telomere test as well. And then a handful of what we like to call wellness panels that are a combination of those tests. But enough of that about SpectraCell. I'd like to get to our speaker. She is Dr. Heather Bartlett. She is a board-certified family medicine practitioner. She's a graduate of St. Matthew's University School of Medicine, and an innovative healthcare leader. You know, the one thing that surprised me about her, or not surprised me, but intrigued me about her, is that she founded Columbus, Ohio's first direct primary care practice back in 2016. She's now established Metabolab and focusing on a cellular up approach, as she likes to call it. Provides medical grade biohacking and advanced care. And her key focus of areas that she is looking at for her patients is cognitive performance, longevity, and weight loss. So Dr. Bartlett's innovative methods bring concierge level care to the Midwest, reversing traditional prescription-based treatments. So with that being said, I'll turn it over to Dr. Heather Bartlett.
Hi, I'm Dr. Heather Bartlett. I have the distinct pleasure of presenting today on behalf of SpectraCell and hopeful learning opportunity for all of you for MTHFR mutations in men's health. As Xavier will have told you a little bit about the lab and a little bit about me. This is my passion, is cellular health and metabolic health. So this MTHFR mutation testing, as well as the intracellular testing that SpectraCell offers, I willingly advocate for my patients to participate in that. It really can be a game changer. So let's jump into this. So MTHFR, so methylene tetrahydrofolate reductase. I'm going to move my camera over for a minute here because it gets a little complicated sometimes. So we know that this is an enzyme that helps convert folic acid into a usable form. And it's important for detoxifying. It's important for neurotransmitter synthesis. And from a cardiovascular perspective that we're going to kind of talk about over and over again, because it's important, it's understanding that homocysteine needs to be able to get converted to methionine. If somebody has these mutations, they may not be able to do that. So when we're looking at measuring these genes, we're looking at to see how well your cells actually methylate, that CH3 group that needs to go on multiple different molecules, how it regulates that enzyme, and how you can try to optimize and work around it if somebody does have these mutations with targeted supplementation. So the common mutations are the C677T and the A1298C. Now, these things we're going to look at in a second about like kind of stats on these as well. But ultimately, these slight DNA repositioning of the different nucleotides can make some pretty big impact regarding the rising homocysteine levels linked to heart disease and stroke, And then with that was with the C67, and with the 1298C changes also causing other unique health implications too. So I think it's important, and I actually show this to my patients, and I inserted this slide myself for sure because I think this is important in people seeing. So I like my patients to remember that we are biochemically driven. Anytime we take any type of drug or a peptide therapy, what we're doing is we're asking the body to respond to what we're giving it. So, it's supposed to create an impact. And I think what we've kind of forgot about in a lot of allopathic medicine is that if a medication fails, or peptide therapy, or even a targeted supplement, then we need to think about, do we actually know what we're treating, and or do we understand if the body has the substrates it needs so it can do what we're asking it to give it the best opportunity. So this is our biochemical chart that most people in healthcare and medicine, definitely physicians, we had to learn this biochemical chart. In pre-med, we had to relearn it again in medical school, and strong aspects of it were also retaught again in our pharmacologic classes in medical school. So I'm going to zoom in here where I've got kind of marked, I think this is important, is that when we're looking at that, the enzyme that we're looking at here, okay, we're looking at this entire pathway here being potentially impacted, okay? And here's our homocysteine over here on the left. If you can kind of see it here, if you follow this line down here, all right? And you can see our methionine here and this kind of loop that happens, and you can see other byproducts that are impacted as well. So when we talk about biochemically this creating an impact or a problem, it's important to remember this is very real. This isn't just the gene, who cares about it. These are all the different cellular machinery, enzymatic processes that can be impacted quickly by somebody having this lifelong. Just think about the importance of that, okay? So to me, this MTHFR and thinking about that, it's as common sense to me testing this for clients that I'm working with as I think we should be testing this on newborn babies, just like we look for errors of newborn metabolite problems with amino acids and such. I think it's that important. So when we're looking at this, like we talked about, super important for heart health related to homocysteine. I strongly encourage, if you're a patient or a clinician listening to this webinar, either test it on your clients, or if you're a patient, ask your doctor to get your homocysteine level so you know where you're at. And that is something they can absolutely order. And SpectraCell, I believe, in their LPP panel as well, I believe they have that in there too. So homocysteine, what is it? It can be a potentially toxic amino acid if it's not able to move through and get to a normal level, okay? So it's supposed to get converted to methionine, which is a necessary amino acid. And it does that by this gene, a normal functioning MTHFR gene. Now, cardiovascular risk with this is elevated with the potential of elevated homocysteine levels, okay? So that's why I say it's important if you're a clinician and you're not routinely checking that, I would strongly encourage you to. If you're a patient listening to this, I strongly would encourage you to get the homocysteine level so you can see this too. The MTHFR mutation testing, you're going to see just how common this is. So for most people, if they have a normal C67, a normal 677 link, okay, 44%, they're going to be normal. Those that have one copy of it, 41% of the population, and those that have two copies of it, homozygous, are 15%. And we're looking at the 1298 mutation, 46% will be normal, 41% will have one copy, and 13% will have two copies of this mutation, okay? So when we're looking at these risks, again, both of them can increase your risk for elevated homocysteine, which is a risk factor for cardiovascular disease, and overall heart disease, and increasing your risk of stroke. Now, something that I think is really important, especially as relating to men's health, and we're going to get a little bit more into that, though, is looking at couples and if they're trying to conceive. Okay, so from pregnancy concerns, miscarriages, and neural tube defects. Unfortunately, so as a family medicine doctor trained, I had to deliver over 40 babies back in the day. Some patients ended up having to go to maternal fetal medicine, meaning a higher risk pregnancy. And it's an unfortunate thing when somebody, a woman, has multiple miscarriages and they have to go through multiple miscarriages, unfortunately, before insurance will often cover this MTHFR genetic testing. And I think that this is something that we could be very proactive in women's health. And I think you're hearing a lot in the media right now about that we should be proactive in women's health, and that We've not done as good a job as we should. Well, this is an easy way to really serve your patients. And if you are a potential patient listening to this and you are having miscarriages, this is an important test to get. So neural tube defects. High homocysteine can interfere with the folate metabolism, okay, which increases the risk of neural tube defects. From a mental health perspective, depression, anxiety, cognitive decline. If we zoomed out of that biochemical chart again, you can literally see where this is impacting your neurotransmitter synthesis, okay. Cognitive decline, it also could be related to different variants with cognitive issues and memory problems. Other health risks, certain cancers, including colorectal cancer, there can be a possibility of increased risk. Thyroid dysfunction, elevated homocysteine levels can be associated with thyroid dysfunction. So, when people hear about this testing, sometimes they think about it in isolation of, well, that's kind of neat, but I don't know if I need it. And we're really looking at a larger spectrum here of the importance of it. And if you're in the longevity and health space as a client or as a clinician, this is important. All right, so looking at kind of what are we looking at from enzymatic activity? And this is part of why I personally, like I said, ask my clients to strongly consider getting this testing because this is a once in a lifetime, one and done test, and then you know where you're at. So, and I think it's important. So when we're looking at enzymatic activity, just saying you have these mutations, and I have clients that come to me and say, I've had this testing, it said I could be, or I'm likely, This is what's kind of more powerful to me about the SpectraCell test, which is they'll actually figure out what the likelihood of enzymatic activity is. What is your percent of normal enzymatic activity function level? So if we're looking at an individual who has 0 mutations, you're at 100% enzymatic activity. If you're somebody that has 1 copy of the 677 and you have normal for the 1298, well, then you're at 66% enzymatic activity. If you've got 2 homozygous 677s and 2 normal 1298s, well, then you're at 25% enzymatic activity. Okay, so you can see this. I'm not going to bore you reading this. But the point being that even 1 copy of either of these can have a significant impact. And if you have, again, homozygous for the mutation and only 1 copy, it really does make a difference in really truly knowing what is your status as far as homozygous, heterozygous, or normal and these mutations. So here's a quick case study. MTHFR testing for type 2 diabetics, a 60-year-old male with well-controlled type 2 diabetes. And this person was homozygous for the C677T variant. Okay, so that's a cytosine that is substituted into a thymine. Okay, so thymine is present instead of a cytosine. All right, so links to complication. There is evidence that suggests that mutations in the MTHFR gene are not strongly linked with the incidence of diabetes. However, type 2 diabetics who are either homozygous or heterozygous for the C677T mutation have a higher tendency, about twice as likely, towards diabetic complications. So increased risk of kidney failure, blindness. These are more likely to progress faster in type 2 diabetics that have this MTHFR mutation. So clearly, patient monitoring, it's more wise to be much more vigilant with kidney function, even though if his diabetes is well controlled. And my take home on that, of course, as a longevity and metabolic and cellular health, is that anybody who has the option that you can work with somebody to not be diabetic rather than a well-controlled diabetic is better. But even with those individuals, this MTHFR mutation, in my clinical opinion, is still critical for overall longevity. Case 2, homocysteine and MTHFR, 52-year-old male. He has a history of high cholesterol and a family history of heart disease. Okay, so he's got the variant for C677. Say that a million times; it's hard to say. And then homozygous normal for the 1298. Okay, so ultimately, based off of testing and targeted supplementation with glutathione, folate, B6, B12, and serine to help those specific deficiencies. And the homocysteine levels decrease from over 13 micromolar down to 8 micromolar, so 13 is high. That's important, and I will tell you in my clinical experience when I'm working with patients and I do this, and I also do the MTHFR mutation test through SpectraCell as well as the intracellular micronutrient testing, and that's how you can get these targeted doses, these specific doses deficiencies looked at. It absolutely does make an impact towards individuals' homocysteine levels and be able to drop them if they are abnormally high. So Risk factors. Patients didn't have any other major risk factors except for heart disease. He was lean, non-sedentary, and non-smoker, but wanted to lower his homocysteine to prevent arterial wall damage and maintain heart health. So looking at these MTHFR mutations and doing this testing showed that this was likely the cause of his high homocysteine despite a healthy lifestyle. And he was not good at moving homocysteine into methionine, as we saw in that biochemical chart I showed you. So targeted supplementation significantly lowered his homocysteine levels with no other lifestyle changes. Like I said, I've seen that in my clinical experience as well. All right. So micronutrients in men's health. So we're talking about specific information here. Excuse me, while I move that over, just so I can make sure I can see everything on here. So age, lifestyle, genetics, medications, absorption rates, gut health, and hormones affect nutrient status. All of those things can absolutely create an impact. Move you back over here. The micronutrient testing. So looking at a total of 31 different vitamins, minerals, antioxidants, and other essential micronutrients with your white blood cells. So I'm going to take a second and just talk about this for a minute. So this micronutrient testing, because you're going to hear a little bit more about it on the next slides as well. It is a different thing for somebody to be saying, oh, I think I need this, or you read some stat on some influencer's page that says, oh, everybody, 60-some% of Americans are magnesium deficient. So for fun, just for a quick clinical example, I always grab a serum magnesium at the same time I grab this SpectraCell intracellular micronutrient test at the same time. And the reason why I do that, and along with vitamin D, B12, folic acid, is because I want my patients to be able to see head-to-head labs that are drawn at the same time that a serum lab does not correlate to an intracellular level. And I've learned never guess what you're going to find on somebody's intracellular level. Everybody is totally different. So the blanket statements that are out there right now, because there's a lot of companies that are, I'm going to say this nicely, they're selling a lot of quote personalized supplementation, but it's based off of a quiz or it's based off of epidemiologic hypothetical large studies saying X number of people. Each person is totally different. So it behooves every patient, if you're listening to this, and every clinician, if you're listening to this, grab those simple serum biomarkers as well as when you do the intracellular, because it's going to be very eye-opening to see really what is the difference here. And you shouldn't guess. There are people that are over supplementing with things that they don't need. They're at optimal levels, so they're wasting their money. And a lot of times people are missing the exact dose they need because, as we know, the liver is going to help us out and try to protect us from high doses of things, which means you really have to get a specific, usually higher dose, but it needs to be a specific dose. And SpectraCell has this worked out that to guide the clinicians on this is the range that needs to happen to move the needle if you're trying to do this. Okay, so that's my little soapbox on that. But I'll say this again: something that is based off of a living cell. So these are T lymphocyte based labs that the micronutrient test that is a living tissue, closest thing we can get to a biopsy of our other tissue, only it's through blood, that has a nucleus, so it does cellular division. So that's what makes it important. So I do not recommend individuals making, this is my personal and clinical view of doing something off of hair or urine. I would rather go off a living tissue that we can mimic and also get a direct look into how somebody's immune function is working, especially with everything that we've dealt with in the past few years. So, so a comprehensive analysis over a longer period than other serum testing, and like I said, and over hair and urine micronutrient testing too, okay? Key nutrients: zinc plays a role in hormone regulation, immune function, wound healing. Magnesium is essential for muscle and nerve function, energy production, bone health. Vitamin D, bone health, immune function, mood regulation. Vitamin B12, crucial for red blood cell production, nerve and DNA synthesis. And I'm going to put a pin in that for a second. And I'm also going to say it's critical for mitochondrial health. Methylcobalamin, again, thinking about the MTHFR mutation, to be able to methylate cobalamin, B12, into methylcobalamin, which is what our mitochondria needs, is a big deal and can be a big game changer. But you don't want to necessarily blindly be giving people methylcobalamin if they don't necessarily need it. But if they do need it, it really can be a game changer. And for those that are also trying to lose weight, in my clinical experience, methylcobalamin, it is necessary for fatty acid oxidation in the mitochondria to take fat and convert it into CO2, H2O, and ATP, cellular energy ATP. Folate, key for DNA synthesis, cell division, and proper brain function. And I'm going to step back one more time for the vitamin B12. There are patients who have had other testing that has said, or they've had a family member that says, oh, yes, I'm pretty sure I've got this MTHFR mutation, or my sibling did, and you name it. And lo and behold, those people test normal or 60%, or there might be one heterozygous variant, and they're at a normal enzymatic level despite that. So they may have been flagged someplace, but they actually are a normal enzymatic activity. Again, testing and really knowing where you're at is better than guessing, always. Okay. And folate, like I said, DNA synthesis, cell division, and proper brain function. So from a men's health perspective, key micronutrients. So prostate health, selenium deficiency can be linked to higher levels of prostate-specific antigen. So for you gentlemen that are familiar with getting this tested, that PSA, low zinc levels associated with prostate inflammation and prostate cancer. So thinking about prostatitis symptoms, improving prognosis. So higher zinc vitamins like K and D can support hormone regulation, improve prostate health. Testicular cancer, essential vitamins and minerals. Adequate level support overall testicular health and may help prevent testicular cancer. Keyword there is may help, okay? But, going back to that biochemical chart, you're asking the body to perform normally. It's better to know where your substrates are, meaning these levels, so that your body can do what it needs to do. Erectile dysfunction, zinc, magnesium, and vitamin D are all essential for maintaining healthy sexual function. Nutrient deficiencies, all of these can also contribute to the erectile dysfunction. All right, so testosterone levels. Essential micronutrients, vitamin D, zinc, and magnesium are crucial for reduction and regulation of testosterone. Deficiency in these can cause hormonal imbalances and low testosterone levels. Stress management, nutrient depletion. I mean, everybody, men and women, definitely daily life stress will absolutely deplete the body of essential nutrients. So better to test, find out, and know where you're at. And, I've got clinical experience patients that have been taking Herbalife for 10 years. I've got patients that come in. So this is not with that micronutrient testing and this MTHFR. There are people who are making a huge, tremendous effort with supplements, trying to do the right thing. And yet they're seeing, for example, me and practitioners across the United States because they don't feel well. And it's because they don't actually know what their body needs. Okay. So, adequate intake, so ensuring vitamins, minerals such as B6, vitamin C, and magnesium can help with that. Again, test it. Don't assume. There's a lot of people that are taking vitamin B6, vitamin C, and magnesium, and they still don't feel well. And guess what? They probably still don't actually know what their levels are. So better to see if these are some of those things. Don't just blindly take it, in my opinion. So now we'll go off to the FAQ. I'm going to answer just a few things here. So how often should I get tested for the MTHFR mutations? Once in a lifetime. Find out, you know where you're at. Your genes are who you are. Can MTHFR mutations be passed on to my children? Should they be tested? It's possible, absolutely. Should they be tested? Yes, I wouldn't go off an assumption. Like I just told you, clinically, I have seen patients who suspected mutations. Don't go off as suspected. Don't go off as somebody else. Know and find out where you're at, because you've got two combinations of genes that have combined to create your amazing body, who you are. Find out where you stand with this. What symptoms might indicate the need for MTHFR gene testing in men? So like I said, if you haven't gotten a homocysteine level test, I would strongly encourage you to do that. If you're a patient, ask your doctor to get it for you. If you're a clinician, strongly consider getting it. I also find getting that intracellular micronutrient testing. I mean, the easy thing to look at that is around your folic acid levels and your cobalamin, your B12 levels. And you've got a slew of other things that just those two cycles, kind of your methionine process between neurotransmitters, cellular replication, and the folic synthesis cycles, those three circles that kind of interact with each other. There's a lot of the intracellular micronutrients that levels that can impact even that. So, we're looking at the mutation where we know, okay, somebody may need targeted supplementation to help with these. Okay, fine. But also, even if you give them those levels of what they need just based off of this MTHFR mutation testing, if you have other hidden intracellular micronutrient deficiencies, you still may not feel the benefit. And so I always find it interesting. I had a patient in the other day, and we'd done the intracellular micronutrient testing, got her on a targeted regimen. and she was coming back in to talk about retesting. And the first thing she said was, well, I mean, I can't believe it. My hair stopped falling out. I have new hair growth. And of course, she feels better. But like the first thing she talked about was hair loss. And she's in her early 60s. And, and she goes, it's probably the biotin in there. And I always have to remind people, if it was just biotin alone and you were already supplementing on biotin and it didn't move the needle, well, your answer is it wasn't just a biotin problem. It was the body's ability all the way around that and anything else that it needed to be able to help with that hair regrowth process. Okay. So, for men, hair loss as well, obviously. If you are having low libido, if you're working out at the gym and you're working out really hard and you're having a hard time trying to figure out muscle gains, if you're getting gassed really easy or really tired after working out, you're putting a demand on your body on top of just life stressors that you should know what level you're at. So that's what I've got for these questions.
Well, Dr. Bartlett, this is Javier Sandoval again, the National Sales Manager of Spectra Sales, and that was an amazing presentation. I think it was extremely insightful, mainly from the standpoint that people don't really understand the importance of being tested for the MTHFR. I think if we were to take a poll out of 1,000 people, 999 of them don't know about MTHFR, much less even how to spell it. So I think that's just been a failure on our part as far as increasing the awareness and helping people understand the importance of it and how it just ties to so many different chronic illnesses and things. And so I appreciate the presentation. It was extremely in depth for our providers, but I think also very beneficial even for our participants that are looking at it, from a personal standpoint. So we had some questions come in through the chat. I think one that you might be able to ask is, you might be able to answer was regarding, can we do the lab test on children? You mentioned that as far as it being a childbirth, but at what age would you recommend someone actually test that child?
I mean, you can hear me okay, yeah?
Yes, ma'am.
Just double checking. Honestly, sooner is better. Because when we're looking at, I am not a specialized pediatric practice, but for clients who specially reach out to me and say, hey, I got a kiddo. Can we talk about how, whether it's school disruption, kind of acting kind of loner, doesn't want to do activity, you name it, kind of moody, and it's not just growing up, middle school age. And the answer is I've actually done the intracellular micronutrient test, and it's always funny. I'll just say this really quick. People don't tend, when things are going well, you don't hear from them. And all of a sudden I get a notification when they're at the end of their supplements, their custom supplements for this young man, that can we get a refill? And I said, well, what's going on? Is he doing better? And so he did not do the MTHFR testing. I don't think, maybe he did. I can't remember, but it's just as important with both of those, because again, I feel like this is a two-step thing. If you get the MTHFR testing and you find out you've got some potential low enzymatic activity, the next thing you need to know is really what is your level. They go hand in hand. So if somebody just blindly goes and does the MTHFR testing and says, well, I need to start supplementing with bio-optimized polygenic polymorphism is everything, so it can just be used and not have to be converted by the body. Fine, but if you don't have everything around it to support it with the other intracellular needs, you may not feel or see a difference even in the kids. So I would say if you've got a kiddo, or even, Australia has looked around, looking around adenosyl cobalamin, and that's going down the pathway of cobalamin B12, looking at kids that are on the ASD, autism spectrum. This is important. And kids now that are picky eaters, that are eating a lot of high carb, high processed food, high sugar, even if it's natural fructose, they may not be getting what they need nutrient wise from what they're taking in. I would say get them THFR. And if you're able to, if SpectraCell, your age limitations, they do it kind of by provider, it kind of feels like, kind of want to know how close somebody is to being around age 12. Get the test and find out. Somebody asked if you should use a 23andMe for it, and I'm going to say right now, no. I have I have another set of high power genetic tests that I utilize, but I still rely on the MTHFR testing from SpectraCell because it gives me that data of the enzymatic and it's not looking at these specific mutations directly. And the same thing when people say, oh, I've got a B12, I've been flagged for B12 on my 23andMe or my Ancestry, and I'm like, it does, and we go ahead and repeat the MTHFR with SpectraCell, and it's not the same level of information. It's different data that they're pulling from. So I hope that answers that question.
The next question was, any thoughts on choline, carnitine, or TMAO?
Yes. So get the tests. Absolutely. So I've had patients that are sensitive. They've been taking high dose carnitine just spontaneously thinking it's a good supplement to take in general and actually starting to not feel well. You want to know because the carnitine shuttle in the body is specific. Okay. Same thing. The reason why you're taking carnitine is hypothetically, are you deficient and you're trying to enhance that? If you don't have the other nutrients around it to support it, it doesn't matter if you take it. So it's better to get the level and know where you're at. Choline, same thing. Uh, I mean, every nutrient is important. All right. So this is why I kind of say I'm a cell up physician, biochemical, because the next class after you take those was pharmacologics and you stop thinking about the basic biochemistry. So if you can support your body and literally in your cells, because just remember, cells create organs, organs together create organ systems, and you get the body. So if you are targeting directly at the cells, you're creating an impact. And I've learned the hard way of working with people before I started including the micronutrient test. So I'm about a year and a half really hardcore using the micronutrient testing as well as the MTHFR. And it's a game changer. I mean, even if people are doing lifestyle changes, I have a participation with the Lumen. People can do a lot of things, and if you don't know what your cells need on top of what you're trying to do and get the demands on it, you're not going to get the response. So am I pro choline, carnitine, TMAO? Yes, absolutely. Do you know if you need it? Why are you going to spend money on supplements that may not move the needle for you when you can find out exactly what you need? That's just my take on it. They're expensive, so you might as well dial it in so you really are there. Okay, sorry.
Yeah,
Hope
that's
that
okay.
answered that.
We had another one. Since it's genetic, technically you can do it at any time, correct? You want to elaborate on that?
Yeah, I mean, it's just a simple blood draw. The MTHFR, you don't have to be fasting. It's, I think you guys, I don't really have people that do MTHFR in isolation. We're usually doing an MTHR and a micronutrient. I know you guys are getting your telomere back online, but I have a lot of patients that do all three of those tests. So, but that's an easy one. You don't need to be fasting or otherwise. I do other labs that people have to be fasting for. You don't have to be fasting for the micronutrient either. So yeah. I don't know if you're asking about time of day or any time, but yeah, you don't need to be fasting so long as you can get the phlebotomy done. That's it.
Yeah, I think they were asking more like time in their life as far as since it's genetic. Obviously, it's not
I
going to
would
change when you're 12 or
sooner than
30,
later,
right?
sooner than later. So when we're looking at, again, if you look at, I also offer gallery testing. Okay, I'm really nerdy about the cell stuff and methylation, and that's literally what that test is about: is methylation patterns on cells, so you can find cancers. So if you care about health from any, earlier, younger, you're talking about cellular replication, right? So every time why I do the telomere test with SpectraCell is that we're looking at the end caps of the chromosomes, and those are protective things. Okay. So if they get shorter and shorter, the likelihood of them accidentally unwinding and doing the ribosomes for our DNA and our RNA replication, every time we get one of these mutations, they keep stacking. Something's not quite right, not quite right. That's how we're putting ourselves up for cancer. Okay, that's one of the ways. It's not a guarantee, but like, why would you not? If you've read Atiya's book, if you care about longevity, if you're trying to optimize yourself, then why would you not do this sooner than later and know where you're at?
Very
What
good.
else we got?
Um, Next question. What are the risks of over methylation? She says, I see many patients taking methylated B vitamins and on their own over the counters without prior testing.
Well, I think I don't know that there is necessarily an over-methylation. However, I would say, why would you ask? I would gear people towards, do you need it? Do you know your levels? Now, we know that antioxidants, especially with what we went through in the last few years, everybody was very high as a kite on antioxidants, trying to lower cytokine storms, everything that was going on. And we have to remember that you can actually, the antioxidants at too high a level will become weaponized by the body itself, and it can be weaponized by viruses. So there is such a thing as too much of a good thing from an antioxidant perspective. Now, the way I look at your question about the methylation is if there's a spillover effect into our antioxidant pathways where that could be making things more revved up, then I would say not a great idea. But also, do they need it? I mean, that's the nicest way to say it. I stopped guessing. Very genuinely, I like to kind of play a game with people. Like, I bet you're maybe a little low on. I don't do that anymore. Everybody is totally different. So if somebody is taking things, the question is why. What data are you going off of? Most people don't realize that there's data that they can look at to give them that guide. Okay, so that's the big thing, is an education and knowing that you can do these T lymphocyte based testing that have a nucleus that do cellular division, and find out. So outside of a quiz, like I said, that a lot of people are doing for supplements, that's not going to be as powerful.
Next question. If you do not have an MTHFR mutation, should I still test my children? Or if both parents do not have a mutation, is there still a risk of our biological children having it?
Great question. I would tell you test, don't guess. Honestly, I don't know the statistics on that, so I'm not going to BS you on that. But I will tell you that I've recently had a couple of clients who are identical twins, and just kind of a background, and it could go either way. That they were like, oh, I'm pretty sure one of our other sisters and our mom has the MTHFR mutation. And so I said, well, I still think you should go ahead and check. And so, but they were leaning off of that, and literally we got the testing back and enzymatically normal. Okay, so don't the stats game. If we were good at the stats games with genes, we would have already figured out cancer. So I would say just test. You don't know, and this all goes back to the cellular replication. When we're being made in womb, how things land, we don't have control over outside of optimization of what our parents did. So I don't know if that, I hope that answered it, but I would say don't play the stats game. Don't Google a paper and say, well, the odds are. Just get them tested.
Great
That was my
advice.
suggestion.
Yeah, great advice. Last question. If they test negative for MTHFR, do they need methylated vitamins?
Well, that's a great question. Now, and I'm sorry, Xavier, I don't want to step on toes here, but I'll just say, like on the other genetic testing that I do offer, the reason why I would say possibly is because we're not just, when we're looking at the MTHFR, we're looking at a very important enzyme that needs to function appropriately, and it can make a bigger impact, as I showed you on that biochemical chart. However, there's multiple things that can impair somebody's ability to actually get higher levels of what they need. So if somebody is going to take a multivitamin, would I say take a over the counter, like a nature made low quality one, versus something that's geared towards it, all the genetic polymorphisms that can happen, so that basically instead of the body having to go from A to B to C to D, now it can use it, it can just go D, utilize. I will always hands down say pick the D, because you've got absorption problems that can happen if anybody's on a proton pump inhibitor, or if they're a hypochloric producer, meaning low stomach acid. All these things can interfere as well with absorption rates. If somebody's had bariatric surgery, there's a lot of that. They've got SIBO in the functional medicine space. You've got a lot of ways that things can go wrong, even getting into you, before even worrying about your genetics taking hold of it and making it into a usable form. So I would, if you're going to take a vitamin, and I would say take a methylated.
Very good. I know there were several other questions asking for treatment recommendations, but we won't obviously make those treatment recommendations via a webinar like that. So for those of you that do have more questions regarding that, if you'll just email support@spectracell.com, we can get you connected with Dr. Bartlett, and you can set up a time to meet with her individually and to go over your particular situation. So with that being said, Dr. Bartlett, amazing presentation. Thank you so much going in depth like you did. I think it was very beneficial, not only for our providers, but also for the average person listening in and to see the importance. Yes, ma'am.
Absolutely. So I was just going to say real quick, as far as chatting with people about stuff, I'm in Ohio, I'm Ohio licensed. So, it could be kind of top level, and I've kind of got limited time. But that said, it really does coming down to those levels, being able to know what to do. And if you don't have the SpectraCell testing, that's the only testing I look at for recommendation. I don't look at, even if patients come in and they've had a hair sample or a urine sample, or they've had a profound amino metabolite urine study through like a functional medicine doctor. I don't look at any of that. We want to look at the living tissue. So we want to know what that is. And I'm sure you've got other webinars planned going more to detail about that, but it is powerful.
Thank you very much. And for those of you that participated in today's webinar, we thank you very much for taking time out of your schedule, as with Dr. Bartlett. And for providers, if you want to order the MTHFR test for any of your patients on the requisition, if you'll enter in and the pay in the special instruction section, MTHFR 20, that'll get you 20% discount on those tests. And also for our participants who are wanting to order online and not through a provider, the same coupon code will be effective for you as well, MTHFR 20, and you'll use that in the checkout at the end of the cart path. So, Dr. Bartlett, again, you were amazing. Thank you so much. And again, thank you for everyone taking their time out to listen in to SpectraCell's Discovery Hour today. Everyone have a great day. Bye-bye.